Alright class, so moving on to cardiac output. Cardiac output is defined as the volume of blood that is pumped by each ventricle in 1 minute. Understand, it's each ventricle in 1 minute. So that is cardiac output. It is actually defined by stroke volume times heart rate. And stroke volume represents the strength, right? The strength of contraction. And heart rate is how many times the heart is beating. So if you think cardiac output is measured in mils per minute, stroke volume is mils per beat. So cardiac output is stroke volume times heart rate. Stroke volume is calculated in mils per beat, and heart rate is calculated in beats per minute. So essentially beats cancel out, so we have cardiac output in mils per minute. So it's the amount of blood in milliliters that is ejected out of each ventricle in 1 minute. That's cardiac output. Few other things: the average heart rate of human beings is 70 beats per minute. The average stroke volume is about 70 to 80 mils per beat. And average cardiac output in a healthy individual is about 5 liters per minute. I just go with 5 liter per minute to simplify things. Alright. Now, we understand that cardiac output equals to stroke volume times heart rate, right? Now, there are some factors that affect the heart rate, and there are some factors that affect the stroke volume. Let's talk about this. Well, heart rate. Heart rate is affected by 4 factors, as you see here. First, parasympathetic innervation. So if you think of your heart, the SA node and the AV node are innervated by the parasympathetic nervous system. So it is innervated by the parasympathetic nervous system. And remember, the parasympathetic nervous system slows down the heart. So parasympathetic, slow. The SA node, AV node, and the myocardial cells of the heart. Let me see if I can change color. Cool, I can. Let me draw the myocardium. Okay, the SA node, AV node, and the myocardium is also innervated by sympathetic nervous system. So this is sympathetic nervous system, and the sympathetic nervous system paces up the heart. So when you are this close to an accident on the freeway, what happens? You hear car honking and all these. Does your heart pace up? Yes, it does, because of the sympathetic nervous system. At that point, the sympathetic nervous system takes over. The sympathetic neurons release norepinephrine, which bind to adrenergic receptors of the specialized cells and myocardial cells and this helps the heart to pace up. Hope that's clear. So one more time, let's review. The sympathetic nervous system paces up your heart, right? Remember, you're very close to an accident on the freeway, so your heart is paced up. And that happens because the sympathetic neurons, they release norepinephrine on the adrenergic receptors of the cells of the AV node and SA node, and also on myocardial cells, which help to pace up the heart. Okay. All right, cool. And then the parasympathetic system, then after 10 minutes, your heart calms down, right? And then that's because the parasympathetic system then takes over and helps it to slow down. There are hormones like epinephrine, norepinephrine, and thyroid hormones. They also help to increase the heart rate. We have some ions, sodium, potassium, calcium. They regulate heart rate. So depending on which channels open and which ions are moving in versus moving out, that also changes the heart rate. So heart rate is affected by your sympathetic nervous system, parasympathetic nervous system, hormones, and ions. So very, very important concept here. Moving on. Now let's look at the factors, or what is stroke volume, and let's learn a little bit more about stroke volume. Stroke volume is the amount of blood that comes out when the heart, so stroke volume is the amount of blood that comes out per beat, right? And stroke volume is divided into 3 components. So this is amount of blood that comes out per beat. Okay. And this is divided into 3 components. First, we have preload. What is that? Now think, let's say you have a high volume of blood in the ventricle. Let's say these are the 4 chambers, right? Now you have a lot of blood in the ventricle right here. So if you have a huge volume of blood in the chamber, what will happen to the end diastolic volume? So the volume is high, right? You have high volume, specifically end diastolic volume. And if you remember, end diastolic volume is the amount of blood, or the volume of blood, right before ventricles contract. So right now the ventricles are not contracted, they are relaxed, and then there is a lot of blood, and so the end diastolic volume is high. If you have increased end diastolic volume, that increases the preload, and this ultimately increases the stroke volume. Obviously, if you have a lot of volume, a lot of blood, and then when the heart when there is a heartbeat, obviously there will be more blood coming out. So you will have more blood coming out per beat, and that will obviously increase the stroke volume. Hope you understand that. Now the second one is contractility, and that depends on the sympathetic nervous system. Remember, we talked about this. The epinephrine, norepinephrine are associated with the sympathetic nervous system. Also, we have other hormones like glucagon and thyroid hormones, which can actually increase the contractile, which can work on the myocardial cells and increase contractility of these cells. So 4 things: epinephrine, norepinephrine, glucagon, and thyroid hormones. All these 4 can work on the myocardial cells specifically, not the specialized cells, the myocardial cells, which in turn increases stroke volume. Okay. And then we have afterload. Afterload is the resistance. It's the resistance that needs to be overcome to push blood from the ventricles into specific arteries. So if we have a lot of afterload, obviously that will decrease stroke volume, because afterload is nothing but resistance. Remember, if you have high resistance, less flow or less stroke volume, I would say. All right. So preload, so to review, preload and contractility. If preload increases, we have increase in stroke volume. If contractility increases, we have increase in stroke volume. If afterload or resistance increases, we have lower or decreased stroke volume. Please do remember this for your upcoming exam. Alright, now some relationship between velocity, blood flow, and cardiac output. Let's review this quickly. Velocity of blood flow depends on the rate of flow and also area. So, if you have, so velocity is flow by area. So if there is increase in flow, if flow increases, that will directly increase the velocity, right? What about area? Area is inversely related to velocity. So if you have an increase in area, that will inversely affect the velocity, right? Meaning this means that the velocity of blood will increase with blood flow. So as the blood flow increases, the velocity will increase. But if the area is increased, that will decrease the velocity. Or we can say that if the area is decreased, that will increase velocity. Now think of this. Let's say you are watering your plants in the backyard with a garden hose, right? The hose has a particular diameter, and there is a regular flow of water out of the garden hose. Now try decreasing the area of the garden hose. So use your thumb and try to partially cover the opening of the garden hose through which water comes out. As you partially cover the outlet, what will happen to the force of water? Well, the force will increase, right? So you will have water jetting out of the garden hose at this point. So my point is, if you decrease area, that will increase velocity or flow. So there is this inverse relationship between area and velocity, and there is a positive correlation between flow and velocity. So as velocity increases, we have increase in cardiac output. Know this. Now, so let's talk about this a little bit more. So remember, the ventricles pump blood, right? Now as the blood is pumped out of the ventricles, it comes to the aorta. And we know that the aorta is super elastic in nature. It can withstand the high blood pressure coming out of the ventricle. So therefore, at the aorta, you will have maximum pressure or maximum velocity. I would just say velocity. Super high velocity at the aorta. And as you move further away into systemic circulation, the velocity kind of dissipates or slows down. So aorta has a maximum velocity followed by the arteries, followed by the arterioles. At the capillary, you have low blood velocity, the low velocity at capillary. And that is important actually. Why? Remember, what happens at the capillary level? There is exchange, right? There is exchange of nutrients. There is exchange of respiratory gases, exchange of waste materials. And you need time for these exchange to take place. So if the velocity is slow, if everything is slow, then there is more time for this exchange. If blood is flowing super fast through the capillaries, obviously there will not be effective exchange. And then when blood reaches the venules and veins, the velocity is very, very low. Okay. So I'll start with a new video because it'll take time for me to explain.